well, the challenges in their journey, and the opportunities of scaling up these interventions. So without further ado, I'd like to invite our first speaker, Christopher Twiss, Head of Sun Civil Society Network Secretariat, to deliver the opening remarks. Christopher carries extensive experience in development sector as well as the corporate world, which includes organizations like the World Bank, Accenture, and the Save the Children UK. In his current role as the head of Sun Civil Society Network Secretariat, he is responsible for managing relations with the Sun Movement Secretariat and the other Sun networks, leading the Sun CSN engagement with latest strategy and looking after the overall work plan and governance of the Secretariat. It's great to have you with us, Christopher, and over to you.
Thank you, Jigasa, and a big hello to you all from the UK. So as Jigasa has just said, my name is Christopher and I'm the head of the Sun Civil Society Network Secretariat based in London. It is such a great pleasure to be with you all today, and a big thanks to Danish and the rest of the team for inviting me. My team in London often reflect that the thing we love most about our roles at the Secretariat is the ability to engage with brilliant national alliances and regional groups. And today I'm so happy to have the chance to spend some time with you all in the Asia Coordination Group virtually. And I very much hope in the future to have the chance to see you all in person before too long. Now, as most of you will know, the Sun CSN Secretariat exists not to lead this network of brilliant advocates and civil society organizations around the world, but to enable it. We want to make sure that our alliances and our regions have the best possible environment to do their brilliant work. And of course, the impact of the COVID pandemic has not changed that objective, but it has changed the way that we have to operate. So for example, we can no longer help in person with regional meetings or meetings like this, be with you face to face, but we can change how we work to still support you in a different way. So we've therefore changed many different things about the way that we operate as a Secretariat and our engagement with the wider network. So the first thing we've done is to ramp up our communications. So we now do a weekly update email to our full mailing list, as well as our bi-monthly newsletter, which I know that Danish passes on to all of you. We also have accelerated the development of our Sun CSN website, which is focused on country stories. If you haven't already looked at that, I'd really encourage you to do so. It's suncivilsociety.com. We've also increased some of our granting work. So we have a new round of grants on meal and sustainability, and we've also facilitated a new round of grants from the pooled fund recently to help many of our alliances, include many of those in Asia. We are also working on our database, which is going to be a one-stop shop for contact management, for technical assistance, for our annual survey, and for much more. And this, of course, is all in addition to our regular country and regional support work, including technical assistance provision, meal services, fundraising advice, and much more, which I hope that many of you have benefited from over the years from the CSN Secretariat. But we really want to hear more from you. So if you have ideas on how we can improve our offering, then we'd love to hear. So please let Danish or me or anyone else in the Secretariat know. Just message us directly, and we'd love to hear your ideas. So that's a bit about the CSN Secretariat, but I'd also love to briefly touch on the topic of this webinar on adolescent nutrition. So only a few years ago, adolescent nutrition was the forgotten part of the nutrition space. It is, of course, still underrepresented and not giving the focus it deserves or it needs. But it's so brilliant to see the Asia Regional Coordination Group, led by Danish, which is definitely one of our finest and most passionate regional coordinators in the network, giving this issue the attention that it really deserves. And I'm really proud to be here to support that ambition. In the Sun Movement strategy, which is being refreshed currently, we state clearly that nutrition is a human and an economic development priority. And making progress on adolescent nutrition and health is absolutely critical to that overarching goal, not just for adolescents right now, but also for future generations. As we know, and as you've just heard, adolescent mothers are often malnourished, often from disadvantaged backgrounds, and often with little or no access to health facilities or social support. This results in much worse birth and nutritional outcomes for infants, and thus malnutrition is passed on from one generation to the next one. Of course, COVID-19 has made this significantly worse again, in that adolescents are now much more likely than ever to be caregivers to younger siblings. And for this reason, both male and female adolescents need balanced nutrition and hygiene knowledge to address both their own nutrition and that of the young infants that they care for. Now, engaging adolescents directly and seeking their perspective can also improve their social standing, their self-esteem, and ultimately help create agents of change for future generations, combating that intergenerational cycle of malnutrition that I just mentioned. So for this reason, the Sun Civil Society Network created back in 2019 our own stream of work to empower young people, called the Youth Leaders for Nutrition program. We support and work with 13 brilliant young adolescents from around the world, many of whom are based in Asia. And they worked together last year to develop a brilliant adolescent nutrition toolkit, along with some brilliant advocacy work, both domestically and internationally. And if you haven't heard of the Youth Leaders for Nutrition yet, then please do have a look at our website. And we'd also be delighted to share the Adolescent Nutrition Toolkit with you at the end of this webinar. Making a positive impact to adolescents is often called the second window of opportunity. And I think you'll hear that phrase referred to time and again over the next couple of hours. And conversations like this one are absolutely critical to making the most of that second window. I'm therefore so happy to see you all on this webinar today and for you to demonstrate your support for this critical issue. Thank you. And I really hope that you all leave energized to take this issue forward in your own countries, wherever they may be. This is such a vital issue and one that we need to take more seriously. As I say, it's absolutely brilliant to see the Asia Regional Group leading on this and being the leaders that we know that you are. So thank you very much. And I'll now pass back to Jigasa to take us through the rest of the webinar.
Thanks, Christopher, for your remarks. And you've perfectly set the context of today's discussion. Adolescent nutrition definitely is a crucial nutrition intervention that requires focus and investment by global and national stakeholders. And now we have a special address by Ann Vavine, the Vice President for Program Operations at Nutrition International, and directs a global portfolio of programs in Asia and Africa aimed at securing lifelong and sustainable improvements in health and nutrition for women, adolescent girls, and their families. Her expertise in nutrition and food security is rooted in field experience from diverse postings working on the malnutrition crisis faced by different countries such as Sudan, Zimbabwe, and Zambia. Today, unfortunately, she couldn't make it to be with us in person, but she's shared a recorded message with us. I'd request our team to play her message.
Dear colleagues, friends, and members of the nutrition community, my name is Ann Vavine, and I'm the Vice President of Program Operations for Nutrition International, joining you today from Ottawa, Canada. I am pleased to welcome you all today and thank you for joining us for this webinar that is dedicated to adolescent nutrition. On behalf of Nutrition International and the Sun Civil Society Coordination Group, welcome. Adolescence is a key milestone in an individual's growth and development and presents a second window of opportunity to address malnutrition and establish healthy habits. This is key to breaking the vicious cycle of malnutrition, disease, and poverty. Improving adolescent nutrition is an investment in health and human capital of both the individual and their family and lasts through the next generation. The Global Accelerated Action for Health of Adolescents, or the AAHA model, provides a guideline for all countries to translate global strategies into action. COVID-19 has increased the risk of malnutrition for adolescent girls and boys. Without school to provide a routine for social interactions and sometimes school meals, adolescents are adrift and more vulnerable than ever. Adolescent girls in particular could end up forced into early marriage or pregnancy, or be exposed to violence, or just make bad choices that could affect her whole future. Historically, adolescents were often overlooked by planners and policymakers. This has left a gap in evidence and knowledge around adolescent nutrition and best practice. To build back better after this pandemic, it will be vital to ensure we are reaching adolescents with the best nutrition and health possible. Nutrition International has made adolescent nutrition a major priority. We are helping country governments in prioritizing nutrition through program planning, budgeting, and implementing nutrition services. We are training teachers and frontline health workers to deliver quality health and nutrition services, and provide information so that adolescents have the knowledge they need. And we're working with other relevant sectors, from education to water and sanitation to sexual and reproductive health. So we never miss an opportunity to improve adolescents' nutrition status. We have also developed the Adolescent Nutrition and Anemia course. It's designed for health and nutrition workers and also those who are interested in adolescent nutrition more generally. The course is available for free so everyone can begin to bridge the gap, that knowledge gap that exists when it comes to adolescent nutrition. That you have all joined us today is evidence that more attention needs to be and is being paid to adolescent nutrition. With the experience and expertise assembled here today, I'm confident this webinar will facilitate a constructive exchange of knowledge and ideas that will help us all move forward in addressing this issue at such a critical time. I wish the best of luck to everyone and look forward to the fruitful discussions today. Thank you very much.
So Anne has well pointed the vitality of focusing on adolescence. It truly is the second window of opportunity for compensating for early childhood growth failure. And like Anne highlighted, there is a crucial need for multi-stakeholder action to address the nutrition issues of the adolescents. On that note, I would like to invite our next speaker, who will enlighten us, the audience, on exactly what comprises of the issue of adolescent nutrition, what its current status globally is and in Africa, and where does it stand in the context of COVID. Ladies and gentlemen, please welcome our next speaker, Lucy Mourage, the Regional Manager for Adolescent Girls Health and Nutrition at Nutrition International Africa. Lucy is a public health and nutrition professional with over 16 years of experience in health system strengthening and nutrition technical assistance to government and partners. She has worked with various development organizations and private sector on policy analysis and advocacy, strategic planning, program development, grant and program management, knowledge management, and stakeholder management. She is an expert in nutrition-specific and sensitive programming and is committed to address the double burden of malnutrition in the most vulnerable, especially children, women, and adolescent girls. We're delighted to have you with us, Lucy. Over to you.
Thank you very much, Jigasa. I hope you can see my screen and you can hear me well.
Yes, we can.
Great. So thanks for that introduction. And without further ado, I think I'll go straight into my presentation today. I will be taking you through adolescent nutrition in the context of COVID and beyond. And we will be looking at a profile and key concepts, concerns for adolescents. We will also look at the impact of COVID-19 on adolescents, nutrition and immunity. We'll also look at what NI is doing as far as programming in this area is concerned and what adaptations we've had to make in our programs. And finally, I will also take you through some recommendations and way forward. So, globally, we currently have about 1.2 billion adolescents, and 16% of this population this 1.2 billion is 16% of the total global population. As you can see in this slide, this is the distribution of adolescent populations. We have about 53% in Asia and 26% in Africa. And 90% of adolescents live in low and middle income countries. And the other thing we need to note is that the nutritional status of adolescents has a profound impact, in their immediate and future health. And until recently, we've not really had a lot of attention to this group, but attention is increasing in this area. We've seen quite a lot of global actions on adolescent nutrition. with the World Health Organization coming up with effective actions to improve adolescent nutrition. And then, of course, the global strategy for women, children's and adolescent health for 2016 and to 2030. And, this issue of adolescent nutrition, it's not a new issue. But with new attention, we're also seeing quite a lot of focus on what issues this group is facing. And if you look at the nutrition transition for adolescents, we will see that the increasing burden of overweight and obesity coexists with continued high prevalence of underweight and micronutrient deficiencies. And that, as much as obesity is a greater challenge in high-income countries and undernutrition in low and middle-income countries, we are seeing a rapid increase of obesity and overweight in low and middle-income countries. And we know that this is due to changes in diet, changes in lifestyle, urbanization, changes in diet choices. We have seen quite a huge prevalence of underweight among adolescent girls. And, there are countries like Niger and Senegal where we have as high as 34% underweight. But then we have other countries in the lower parts of Africa, like South Africa, where we have, quite some high levels of overweight and obesity. And the other issue that I would like to highlight is really the issue of anemia. Iron deficiency anemia is quite widespread. If you look at this graph here, estimated top 5 causes of disability adjusted life years lost by sex and age in 2015. And this extract is from the Global Accelerated Action for the Health of Adolescents. You will see that iron deficiency anemia was identified as, the leading cause of disability adjusted life years lost, and especially for adolescent girls. And we have also seen that, approximately 30% of adolescent girls globally are anemic. And we know that WHO considers more than 20% a public health concern. And this we know is due to their higher iron needs and also low dietary availability of iron, of course, combined with parasitic infections. And we also are aware that, the potential consequences of anemia is poor school performance, you have loss of productivity. And then, of course, for girls later on in life, if they do choose to get pregnant, then we end up having negative reproductive outcomes. And, what is the situation in Africa? Adolescent nutrition in Africa and malnutrition specifically, we've seen, that the global situation of double burden also exists in Africa. We have prevalence of thinness at about 14%. Overweight and obesity, we are seeing the levels of especially obesity in the southern parts of Africa being quite high, especially among girls. And 20 to 30% of our adolescents and young adults are living with non-communicable diseases, such as diabetes. And when it comes to anemia, again, micronutrient deficiencies, and specifically anemia, we have 1 in 3 girls who are anemic. And a study by UNICEF also found that 4 of 8 African countries have anemia levels of over 40% among 12 to 14-year-olds. Now, this is the situation in terms of, malnutrition. Now, when we look at what is currently happening in the world, and here we're talking about the COVID-19 pandemic, we have seen that, there has been increasing cases of COVID. We have seen that a lot of countries are having very high levels of infections and deaths as well. Interestingly, and this has been a point of debate, is that Africa has not been as affected or seems not to be as affected as other parts of the world. And there are many reasons that have been given as to why this is the case. But it does not mean that we are not also facing the challenges that come with the COVID-19 and the effects that this has had on health and nutrition as well. And so I just want to take you through this illustration from, and this illustration is from the latest report on progress by Every Woman, Every Child Global Strategy for Women, Children and Adolescents Health. And if you look at the illustration of what is currently going on, in terms of what impact COVID has had on non-COVID health outcomes for women and children, there's little doubt that an economic, social, and health crisis is happening currently, and that the severe widespread of COVID-19 will definitely negatively affect the health and well-being of not just women and children, but also adolescents in every setting. And as a result, slow down or reverse some of the progress that have been made so far. And the considerable uncertainty over how long this will last, or how countries should respond, makes it difficult to predict the extent of the negative direct and secondary effects, where they will be most significant and who will be most affected. But we've seen some modeling happening, and here, when you look at the issue, the direct health impacts of COVID, we've seen a situation where, due to lockdown, limitation of movement, school closures, we've seen that there has been secondary environmental, psychosocial, and also economic results coming from this. And one of the issues that I would like to highlight is the fact that we have closures, the psychosocial issues that we are seeing, the increase in isolation, lack of daily activities, lack of peer support. We are seeing an increase in depression and anxiety. We are seeing an increase in, of course, cyberbullying for especially for young people. There's also the fear that with the lockdowns and school closures, there's a high likelihood that a lot of girls will be affected and may not also be able to go back to school when schools reopen. And so, if I'm to just mention briefly school closures, and why do I want to zero in on this? We know that a lot of the preventive health and nutrition services that are offered to young people are usually offered through the school system. And as much as adolescents are not as severely affected by symptoms of COVID-19, they're equally susceptible and equally contagious. We have seen massive school closures in Africa. We currently, globally, we have about 53 countries that have closed schools and over 800 million children affected. And this also means that these children will not be able to have access to a lot of, not just to an education, but also to the services that I've mentioned, health and nutrition services offered through school. And the truth is that school closures are a detriment to learning and harm human capital, and some of the children are likely not to return. And projections from 2020 to 2030 suggest that the economic consequences of COVID pandemic could cause a third reduction in progress towards ending gender-based violence, and could also result in about 13 million child marriages taking place that otherwise would not have taken place. And as Malala says, in a crisis like COVID-19, girls and young women are the first to be removed from school and the last to return. And so, the expected implications on adolescent nutrition programming, if we are to look at previous crises, if we are to take an example of Ebola in West Africa, is that, there are long-term adverse impact for adolescent girls we risk having an increase in anemia. Of course, school-based education discontinued, a rise in early marriage, and I've mentioned all this. Engagement in low-paying and exploitative economic activities. And then, of course, an increase in gender-based violence and a decrease in a focus in preventive services. Why are these things important? I just want to quickly talk about the role of nutrition in immunity. And we know malnutrition can make a person more susceptible to infection, but we also know that infection also contributes to malnutrition. And a balanced diet and adequate nutrition is needed for cell function. And so it's important to maintain a healthy diet and a healthy lifestyle. A healthy diet, is not a guarantee that it will prevent you from getting COVID, but maintaining it helps to maintain a healthy immune system. And because this ensures that it decreases the likelihood of an infection. But we are not saying that there is any single food known or supplement known that has been shown to treat coronavirus or COVID-19, or that has been authorized as a treatment, and no specific food or dietary supplement have been shown to directly prevent infection. But it does not, however, mean that nutrition is irrelevant where COVID-19 is concerned.
You have 3 minutes left.
Thank you, Kiza. And so, just ensuring that we maintain good nutrition is critical in ensuring that we keep our immune systems healthy. And I'll quickly just run through what NI has been doing in this area, especially in Africa. I think I'll skip this slide because it's been mentioned that NI works in all these countries. And we work based on, we anchor our programs in WHO guidelines. And so our programs are both nutrition specific and nutrition sensitive. Our adolescent nutrition programming is basically weekly and iron folic acid supplementation for girls, but also nutrition education for both boys and girls. And, other interventions to keep girls in school and delay marriage and pregnancy. And, in terms of the challenges we've been experiencing as far as this period is concerned, one, and this has been mentioned, is financial and human resources. Of course, the lockdown of schools, and I have mentioned this. Then, of course, seeking health services has been a challenge, as we know, with the lockdown and with the limited movement and fear and stigma. Lack of coordination has been a major issue among various stakeholders. And then a major issue also has been that community health system that then is the fallback has not been very well resourced. And, NI has adapted in different ways through technical guidance, rapid assessments, and also trying to use the community health system and work with governments to ensure innovative ways of integrating behavior change intervention. Monitoring digitally through virtual systems to ensure that there is service availability and that stockouts are dealt with. So what have we learned so far? That, adolescent nutrition and policy and strategy environment is critical. Where this is available, then it becomes easier to implement a lot of these things. And multi-sectoral collaborations cannot be overemphasized. And the other thing is that there's a great need to ensure that, there's data, because this is the only way to be able to have real-time data that you can use to then plan on time. So I'll quickly, I just have 2 slides left, Kiza. So I'll quickly finalize this by saying, what are we then recommending based on what we have learned so far? That supporting governments to improve the policy and strategy environment is key. Strengthening collaborations and partnerships between the different departments, between government ministries, and between different partners is very critical. It is important to promote gender equity in programming and address barriers that then stop access from services for especially for women and girls. Strategies for behavior change interventions need to be context specific and evidence informed. And it is important then to also work with adolescents to ensure that our programming is actually addressing their real and felt needs. And I will finish with this slide. So what do we do going forward? We are seeing a lot of schools starting to open up, lockdowns are being lifted, and it is critical that then we ensure that we build resilient adolescent nutrition programs. And why do I say this? Previous delivery platforms have been tested. We've been delivering through schools. This hasn't been possible since the closures. And so it's important to ensure that even when there is a crisis, that services to this group continue. Multisectoral collaborations, I won't really dwell on this any further. Cross-learning is very critical between regions, between countries, between organizations, and we are seeing a lot of information coming out. We cannot overemphasize the need for a robust primary healthcare system. The truth is that there is no universal health coverage without nutrition. Social and behavior change interventions are critical because we have seen how well these have worked in preventing COVID, but also in building positive behaviors for populations. And again, this has been a big opportunity for the nutrition fraternity to mainstream nutrition in other sectors. And so we urge all people to ensure that we continue with this momentum and not lose it. And again, social safety net initiatives, food security, health and nutrition, social services, we have seen that all these sectors must be able to work together even as we move forward. And finally, we need to strengthen our data systems because it's the only way we are able to act and act on time, especially in times of crisis and even going forward. And I'll leave you with this quote from Dr. Babatunde, that when young people can make a healthy transition from adolescence into adulthood, options expand for their future. Thank you very much. Over back to you, Jigyasa.
Thanks, Lucy, for bringing attention to how the current pandemic really jeopardizes the hard-won development gains made in adolescent nutrition over the past decades. You very well captured the impact of COVID on adolescents. They're clearly not just missing education, but also are at a higher risk of anemia, early marriage, unplanned and early pregnancies. An interplay of all these factors is what contributes to achieving the Sustainable Development Goals and realizing a healthier economy. Thanks, Lucy, for your presentation and your remarks. And now we can see there are some questions for you in the Q&A box. So I would like to invite Anjali Bhardwaj, Regional Manager, Adolescent and Women's Health and Nutrition at Nutrition International Asia, to moderate the Q&A session. Over to you, Anjali.
Thank you, Jigyasa. And thank you, Lucy, for a wonderful presentation. It was very comprehensive and gave us a very nice overview of the current situation. So there are a few questions for you. The first one is from Alia Ambreen. She wants to know that can we take vitamin D supplements that are being advised by doctors for building immunity against COVID-19? And is it safe? Or do we need to check vitamin D levels first? Hello, Lucy, can you hear me?
Thank you, Anjali. Yes, I can hear you, and thank you for that question. I think I've mentioned that, what we are emphasizing is really a healthy diet and a healthy lifestyle. So far, we do not have any scientific evidence that there is any benefit of, or rather, taking supplements does not protect you or prevent you from getting COVID. But we are saying that it is important to maintain a healthy diet, and it is important that we all ensure that our immunity is high, and so that if in case of any infection, then your system is ready to fight any infection that comes. And I think one of the issues that I needed to mention as well is that if we are undernourished in any way, this weakens our immune system, and it keeps us at a higher risk of infection. Again, if we are overweight or obese, then this actually means that we are at a higher risk of a more severe infection. And so this double burden of malnutrition is what we need to ensure that we keep off. And so that in case of any infection, then our systems are ready and to be able to fight it. Back to you, Anjali.
Thank you. The next question is Matilde Chisa has asked, have you been able to identify or collect case studies on the mobilization of community health systems for delivery of adolescent nutrition services during COVID?
Thank you, Anjali, for that question. What we are seeing in a lot of parts of Africa, especially, is that our community health services have come up and come up with, countries and governments have come up with innovative ways of ensuring service provision at community level. A lot of governments use community health workers or community health volunteers in order to deliver services. If I can give you the example of Kenya, where we have a community health service and a community health system, what we are seeing is that the government efforts are being integrated not only at facility level, but at community level to ensure a lot of these preventive services and behavior change communication is actually being done at that level. In countries like Ethiopia, where we have a very well-established community health system, it is these community health workers that the government is actually making use of to be able to not only mobilize communities, but also to pass messages. Not only to pass messages of hope, but also to ensure that, women and children, and especially the most vulnerable, like pregnant women, still ensure that they attend health facilities when it is needed, and that deliveries at health facilities also happen. We know that when COVID started, there was a lot of fear, there were a lot of misinformation, but it is through these community health systems that this misinformation and information, the right information, has been passed to communities. And we have also seen countries where they're using young people, because as we have heard from experts, young people, as much as they are susceptible, we have seen that a lot of young populations are not getting as affected as the older populations. And so we are having governments also, mobilizing the young people to actually be the ones to provide services at community level. Back to you, Anjali.
Thank you, Lucy. Yeah, I think that your answer also covers a few more questions that we have received about school closures or partially open schools and how that is impacting the adolescent nutrition program. So if I were to club them into one, maybe could you suggest some other alternatives to the school-based adolescent nutrition program?
So thanks, Anjali, for that. And I think for Africa, we're learning a lot as well from Asia and what is happening in Asia. We have seen situations where some countries completely stopped any programs that were going on through schools. But we have also seen countries adapting and ensuring that, services are provided through the community systems, as I have mentioned. An example is the weekly iron folic supplementation program. We are seeing countries adapting and ensuring that, as opposed to when we would give a tablet every week or a supplement every week through the teachers, we are seeing countries actually coming up and mobilizing adolescent girls to go to the facility level where they are able to receive a month's supply of weekly iron folic supplementation. And then we have community health workers then following up through the households. And this is because a lot of these community health workers come from the same communities that they're working in. And so they are able to identify the sort of their catchment of young girls that they need to reach. And so that is one way. And of course, we've also seen young people working as peer educators. And we know that young people listen to each other quite a lot. And so when you have one young person talking to the other, then it becomes also easier to accept the message, and also to ensure that then we have them being ambassadors of health and nutrition. And so it's also to just say that, you know, even as we go forward and build our nutrition programs, it is critical to ensure that we also, as I said, make them resilient and come up with ways of ensuring that even in times of crisis, that these services can still be offered. And so this has been a big learning, I think, even for us in NI, that as much as we are implementing programs through the school system, it is critical that then we have a linkage to the community health system for sustainability, and also for in times like this to ensure that services still get to those who need them. Thank you, Anjali.
Yeah, thank you, Lucy. I think you very well covered most of the questions here. There are some more, I think, which will be answered as we present the case studies from Nepal and Bangladesh. So maybe we can hold on to them now. Jigyasa, over to you.
Thanks, Anjali, and thanks, Lucy. Yeah, we really see that there are many questions on, means of reaching the adolescents beyond schools, and, what are the different digital options that can be explored. So we'll, ask our participants to stay on, and, there are these innovative efforts that are going to be discussed as we move forward in the upcoming sessions. So let's move on to the next session, where we learn from our experts about the adolescent nutrition strategies in Bangladesh and how they were adapted in the COVID scenario. To lead this session, I would like to invite Saika Siraj, the Country Director of Nutrition International in Bangladesh. Saika is a public health specialist with over 15 years of experience in maternal and child health and nutrition, and she's an active advocate for nutrition opportunities for vulnerable communities and has been the nutrition focal point for various international development organizations. In her current role at Nutrition International, she oversees organizations' programs in the country and provides strategic guidance on project development and implementation, partnership strengthening, and research and monitoring. She's an active member of various nutrition and health related working groups in the country, where she supports in the development of national level strategies and frameworks. It's great to have you with us, Saika. Over to you.
Thank you, Anjali. Hopefully everyone can see my screen.
Yes, it's clear.
Okay. Thank you. Thank you so much. And thank you also, Lucy, that she actually laid a very nice kind of elaborate foundation on how adolescent nutrition has become a lot more important during the time of COVID and beyond. Today, in my presentation, I'm going to focus on what is the adolescent nutrition status in Bangladesh right now, and what are the policies and guidelines available from government, and how NI is reaching out through different platforms to both adolescent girls and boys. And at the end, exploring new platforms and effective ways to reach adolescents during COVID-19. So if we look at the data of adolescent nutrition currently in Bangladesh, we will see that it's around 36 million adolescent right now in Bangladesh. And regarding school enrollment, especially in the secondary school, only 73% of the girls are getting enrolled. At the same time, there is a 1/3 of these girls are also dropped out in the secondary school. The early marriage is also quite high, and around 60% of the girls are getting married before their 18th birthday, and among them 50% are getting pregnant before their 18th birthday. And as also Lucy has mentioned, the birth outcomes, around 18% adolescents are having live births. So it is actually not a very promising situation. And if we look at the nutritional data, we will see that there is both micronutrient malnutrition and the double burden of malnutrition. So if we look at the major micronutrients that adolescents are deficient in Bangladesh, we will see there are high rates of anemia. Around 60% are having zinc deficiency, and most all other major micronutrients, we will see a lot of high level of deficiencies. Almost 1/3 of the girls, adolescent girls, are stunted in Bangladesh. At the same time, in both rural and urban communities, we are seeing increased rates of obesity and overweight. So if you look at the government policies regarding adolescent nutrition and overall adolescent health in Bangladesh, you will see that these are quite recent. And the first very specific kind of guideline that came out is in 2015, where in the National Nutrition Policy, adolescent were mentioned as a specific age group that needs to be addressed. And previously, I think the focus were more on children under 5, pregnant and lactating mothers. And subsequently, there was a national plan of action, which also mentioned that we need to address the adolescent nutrition and how and the way forwards. In the other 3 documents I have mentioned here, the 4th Health Population Nutrition Sector Program, National Strategy for Adolescent Health, and National Plan of Action for Adolescent Health Strategy. All these 3 things, 3 guidelines kind of focus more on adolescent health, a little bit on adolescent nutrition. So there was a felt need for, quite a long time that a specific guideline is needed for adolescent nutrition. And just recently, operational guideline on school-based adolescent nutrition interventions came out. This is a joint guideline developed by Ministry of Education and Ministry of Health. But this only focuses on the school-based adolescent programs. But this is kind of the first guideline which actually have more detailed kind of description on how to move forward with adolescent nutrition in a school-based platform in Bangladesh. So if I go to what Nutrition International has done and is doing regarding adolescent nutrition, we started in 2016 in Bangladesh doing a formative research to really understand what are the challenges and what are the barriers and what exactly are the problems with adolescent nutrition. In late 2017, we started a campaign called She Will Grow Into It. And then in 2018, we started our first school nutrition program for adolescent. 2019, we started working for nutrition for working women, because a lot of the adolescents who have dropped out of school or not in school are actually working in the ready-made garment sectors. So we thought these are the kind of activities can cover a lot, big cross section of the adolescents if we go through these different platforms. So in the formative research that we did, what came up was that there was inadequate knowledge on malnutrition and micronutrient deficiencies. Girls really didn't understand that what exactly it meant and what harm it can do and why it is so important to have good nutrition. At the same time, we saw there is very poor level of knowledge and practice on dietary diversity. I already mentioned that the secondary school enrollment is quite low, and there is high dropouts. And at the same time, the formative research also identified early marriage and early pregnancy as a major barrier. And recently, unhealthy lifestyles has become another major barrier, which is kind of putting us in a more difficult situation of double burden of malnutrition. So Nutrition International developed a campaign for adolescent girls especially. So the idea was, with good nutrition, she will grow into it. And we wanted to draw attention on the importance of good nutrition in unlocking the barriers to girls grow up to their potential. So we organized national and subnational level workshops with adolescent girls and boys to where they identified that what are the barriers to their proper nutrition, how it is actually taking them behind, and how they can actually overcome these barriers. So it was a very interactive movement, and from where Nutrition International also shared toolkit for them through which adolescents can raise their voice regarding nutrition and nutritional problems and their in different medias. Next, we thought because majority of the adolescents are in the schools, we need to have a strong school nutrition program for adolescents, and where we have to also think in a gender sensitive way by including both girls and boys in this program. So we started in 90 schools covering around 32,000 adolescents, among which around 15,000 were girls. And the idea was to reduce the prevalence of anemia among the girls and also increase dietary diversity and good nutritional practices among both boys and girls. So we started in two of the southern districts, and from which the idea was to learn how we can scale up this kind of interventions, and the government can really take up and replicate in all around the country. So the intervention package here included behavior change communication on nutrition, iron folate supplementation, deworming, wash and menstrual hygiene management. And there was also weekly provision of iron folate supplements for the girls, and hand washing and sanitation. At the same time, support for menstrual hygiene management at schools. Through the SNAP project, what we were able to do is that we were able to convince the Ministry of Health and the National Nutrition Services to form a technical advisory committee, who now will be the apex body to take forward the adolescent related interventions. If any legislation or anything needs to be developed, or there is a need for something, this technical advisory committee is going to be the one who will be taking it forward. And this will comprise of both Ministry of Health and Education personnel, and also the key stakeholders working in the adolescent sector. Through this project, we were also able to push Pushti Bandhu or nutrition volunteer concept, which has also been incorporated in the guideline that I previously mentioned, just recently came out. So these nutrition volunteers in the school will be helping their peers to gather proper information on nutrition and practice them. We also were able to bring on board the National Curriculum Textbook Board while developing the behavior change communication materials for adolescents, and also Ministry of Health was part of it. So now these materials are being approved by both Ministry of Health and Ministry of Education, which kind of gives us a very good buy-in from both the ministries, because both of these ministries are reaching out to the adolescent in their different activities. And during COVID, as you all know, from March 16, actually all educational institutes got closed, and that's why this project is right now on a hold until now, although the offices and other things open, but this educational institutes are continuing to be closed. So in the later part of the presentation, I will talk about what else and what different approaches we are actually thinking to take. So the other project that we were, this is also a research project to understand that a majority of the dropout adolescent girls and those who didn't get enrolled in the school are working in the ready-made garment sector in Bangladesh. So actually not addressing them, not reaching to them is a missed opportunity, and we will not be able to kind of reach to a large segment of the adolescent girls if we are not addressing working women's. So that's why we started a project with the Bangladesh Knitwear Association, and we are reaching around 240,000 workers, among which 180,000 are women, and we are reaching in 154 factories right now. And these are small, medium, and large factories, a mix of them, to understand better that how really we can implement this kind of a project in private sector settings. This project also emphasizes and targets female adolescent workers, not only adolescents, women workers, to have weekly IFA supplements. If there is a pregnant woman among the workers, then they are receiving regular supplements of IFA. And at the same time, both male and female workers are getting behavior change communication interventions. So through this project, we were able to actually reach out to all the factory managements and train the factory staff on nutrition, which they will be gradually implementing in the factories. So this project, the biggest achievement we got, I think I would say, is that there is now a MOU within the Nutra Association of Bangladesh and National Nutrition Services of Bangladesh and NI, and through which we were able to mobilize 2 million IFA supplements for these factories, factory workers during the project period, and with the commitment of having more if we can scale up and take these interventions forward. And so far, we were able to train 192 RMG trainers who now are training other workers in the factories. And around 5,000 workers have been oriented on nutrition, and they are also receiving IFA supplements on a weekly basis. For the RMG sector, the COVID-related challenge was a little different because initially it stopped, but during April, the government took a decision of gradually allowing in a limited scale to open the factories. From May, they started working, and right now all the factories are maintaining the safety measures that they're working full swing. So which gave us opportunity to continue this work. And I think also from the Nutra Association, we understand they see this program as a more relevant program right now after COVID has started than before.
Saika, sorry, you have 2 minutes left.
Okay, yeah, I'm done. I'm almost at the end. Okay, so as I mentioned, these challenges, so I think from Lucy's presentation also it came up. Most of the countries, also in Bangladesh, the platforms through which we want to reach adolescents are institutional or mainly educational institutions, and there is really a lack of approaches that has been designed to reach adolescents at the community. With a country where we don't have 100% enrollment in secondary schools, it's very important to actually go in a way that we can reach the adolescents in the community, and that is where we are emphasizing and focusing right now. And we are working with both Ministry of Health, Education, Family Welfare to identify the best way during COVID and beyond COVID to reach out those girls who will not be going back to schools, or they were not in the schools. And right now in COVID, everyone is actually, we have to reach all the adolescents through this community-based approach. And then the linkage between health and education platforms are also very important. Oftentimes there are nutrition programs in school, but does not really directly link with the health activities and the National Nutrition Service activities, where we have played a really important role to bring together the Ministry of Health and Ministry of Education and ensure supplement of IFA in the schools through the National Nutrition Services. And during COVID, another thing came up as very important is digitization of SBCC materials and modules, because once we cannot do one-to-one counseling or in the school platforms, it's very important that we reach out to the adolescent and their caregivers through different platforms. And now that there is a lot of interest from government and other agencies in working with adolescents, it's also very important to harmonize the messages. Otherwise, we all will be kind of providing different messages, which will confuse this very sensitive kind of target population. And the plan is, and what we think is very important, is to incorporate the key messages in the textbooks, and through the results we will get from our adolescent school adolescent program, that is one of the key activities that we are negotiating with government to do. So these are the partners that we are working with: Ministry of Health and Family Welfare, Ministry of Education, different departments of these two ministries, and the Nutra Association of Bangladesh. Implementing partner, we have BRAC. We are collaborating with UNICEF because they're also working a lot in this field, and we have VIID and Sharno Kishori Foundation, which they also have adolescent reach through different platforms. So that's it. Thank you. Back to Jigyasa and Anjali.
Thanks,
Thank you,
Saika.
Saika.
Thanks for those insightful remarks and presentation. And it definitely reflects on the power of engagement. You rightly emphasized on the importance of actively involving adolescents in the policy development. Campaigns like She'll Grow Into It, these workshops with adolescents to understand their barriers to nutrition, are really innovative initiatives which can help adolescent nutrition strategies become more closer to reality and address the real issues of the vulnerable group. And I think there are some questions which are there in the Q&A box. So I'll invite Anjali again to moderate the Q&A session. Over to you, Anjali.
Hi, sorry. Yes, hi. Thank you, Jigyasa, and hi, Saika. Thank you for this comprehensive presentation. I think I can direct a couple of questions to you. The first question is directed for Bangladesh. So, how is the VIFA's program implemented at the community level in Bangladesh?
So if you're talking about the WIFA for adolescent girls, what is right now available is that all the community-based and sub-district level or district level health facilities would have the supply of IFA supplements. And then if an adolescent is reaching out to those facilities, they are given those supplements. But if we are talking about a structured program where from the health ministry or any other ministry, adolescents are being reached out, right now we don't have that kind of a program, but the message is there, and adolescents are always welcome to any health facility too, and they can get IFA supplements free of cost.
Yes, and a VIFA's program is also being planned, but it's right now
Yes.
not
Yeah.
in operation, right? Yeah.
Yeah.
Another question for you, Saika, is asked by Fazlul. He wants to know about, what has been the situation of adolescent and women workers in the factories during the lockdown. Because we have heard reports from some other countries that there were large-scale migrants going away from the cities during the lockdown. Has something similar happened? And if yes, then how was the IFA supplementation managed during this time?
Right. That's a really beautiful question, which actually I missed out to say during the presentation. So initially, when the schools were locked down, and in the very first stage of the lockdown, um, the factories we were working in, we provided a 2-month supply to the workers so that they can take it at home. But then we were actually in a little bit of confusion that if the factories will open so soon or not. And as you said, regarding the migration, that happened at the initial stage, but gradually when the factories started opening up and the government took very good measures to actually bring back the workers, they again, most of them came back, but I wouldn't say that 100% of the workers had come back. So there is a 10 to 20%, we lost some of those workers who have gone back to their hometowns and did not come back. And also there were some because initially, and even with the global situation now, the orders that government factories are receiving are not as many that used to be. That's why their number is a little lower. But as I said, that for 2-3 months, it was complete lockdown for 1.5 months. From the second one, it gradually started to open, and now it is working in full swing.
Thank you, Saika. Just one more question for you. And this is linked to nutrition education, because you do work closely with the Ministry of Education. So there's a question about if you could suggest innovative ways to deliver nutrition education during COVID.
Right. So I think right now what we are feeling in Bangladesh, the two big approaches that were taken is, one is people are trying to digitalize some of the information. So those people who have access to computer or smartphones will be able to see those. So this is in process, and a lot of the organization, including in international, are trying to do this kind of activities. From government side, there was an initiative taken because the smartphone penetration is not that high in our country. Through the television channels, classes were broadcasted so that, you know, most of the students can at least watch those things and those classes and can continue their studies. But this was not focused on nutrition or that kind of messaging. But now we are also in conversation, and we think it's a very good approach, because television, reach of television is much higher, and then that could be one innovative approach to reach out to the adolescent with nutrition information. But then right now, then that gradually things are opening up, the health facilities were open, and government also have health outreach workers at field level. So those are also the platforms that we need to utilize to reach out to all the adolescent girls and boys.
Thank you, Saika. That's very useful. Over to you, Jigyasa.
Thanks, Saika and Anjali. And it was an enlightening Q&A round, definitely. I mean, there are a lot of questions that we're seeing are coming on understanding what does the world look like post-COVID, and how do we really adapt to all these things. So it's quite invigorating to really hear all the questions. And now we move on, and we move a little north from Bangladesh, and we move towards Nepal. And I'd like to invite, for the next session, Professor Uma Koirala. She's the chairperson of Civil Society Alliance for Nutrition in Nepal. Professor Uma has more than 30 years of experience in university teaching and research in the area of nutrition, food security, and gender and social inclusion. In addition to her vast theoretical knowledge, she possesses excellent skills in policy analysis, program designing, social development, monitoring and evaluation, research, policy formation. She's an expert in gender and gender audit. I'm sure it will be an illuminating experience to hear from you, Professor Uma. Over to you.
Thank you very much, Jigyasa. Namaste, good morning, good afternoon, and welcome to all. It's my extreme happiness to present my country's adolescent scenario and coping strategy of our very, very energetic and potential cohort of the population in this fragile situation. Thank you, organizer, for providing me this unique opportunity, and thank you to all to the previous presenter for a wonderful presentation as well. I'm presenting my adolescent scenario and coping strategy and the situation of the COVID, adolescent nutrition in Nepal, and especially we are trying to breaking the cycle of malnutrition through empowering adolescents and making better life of adolescents so that we can break the cycle. If we go to the structure, adolescent population are 1/4 of our total population, where 49.1% are girls and 50.9% are boys. And youth literacy rate is quite lower for girls. It is 7.39% and 92.59% for boys. And it is another big issue of our country, the early marriage of adolescent girls, where 7% of all adolescents married before 15 years of age, and 40% of adolescent girls are married before 18th year of age. So these are quite crucial issue, and we are very seriously addressing these issues. Though the median is for first marriage, the government had decided 20, but but lowest in province 2, 5, and 6. It is very critical in those areas. And according to UNICEF, Nepal has the 17th highest prevalence rate of child marriage in the world. And World Bank study on 2017 estimates that ending child marriage in Nepal could see a 12.7% rise in earning and productivity. So with this forecast, we are heading towards our strategy and all our effort to reduce these numbers so that they can enjoy and they can work with their full potentiality. Here, I'm just showing this cycle, and here with the productivity and the full potentiality of adolescent we want to address so that they can improve their whole cycle of life and improve their coming generation with healthy pregnancy and healthy womanhood or motherhood. Actually, why, though my previous presenter Tate is already emphasized on the issue of nutrition matter, why adolescent nutrition matters so much? Because addressing the nutrition need of adolescent, breaking the vicious cycle of intragenerational malnutrition, chronic diseases, and poverty. Similarly, the increased burden of overweight and obesity in adolescent coexist with continued high prevalence of underweight and micronutrient deficiency. And the GAIN has forecast that if current trends continue by 2022, more children and adolescents will be obese than underweight. So it is quite serious scenario. So our country's effort is to create opportunity to the adolescents so that they can act as an agency for the change of the society and work with their full potentiality. So we have 4 strategies on this. First, building competency, for which we are working with the knowledge, attitude, the skills of the adolescent girls, so the adolescent population, so that they can build their competency. And we also working on application of a skill by creating enabling environment and a structural change so that they can have a better skills. And empowerment, yes, definitely we are empowering them for the role of agency, autonomy, and efficacy for their betterment and for the betterment of the society as well. And yes, improved life outcomes by better health and well-being, education, and protection. Through these things, we want to create and enhance their agency role. So we are urging government and other stakeholders to invest more on their knowledge sector and invest more with the more money and the capacity also. Just I want to little bit change the talking point, and I want to present our situation of adolescent, nutritional situation of adolescent in Nepal. Overall, 1/3 of the adolescent boys and adolescent girls are stunted. 1 in 10 adolescent boys and 8% of adolescent girls are severely stunted. 4 to 5% adolescent boys and girls are overweight. 1% adolescent boys and girls obese. And anemia prevalence is increasing in trend among adolescent girls of 15 to 19 years from 39% on 2006 to 44% in 2016. And anemia prevalence among adolescent boys are reported also high from 24 to 52%. If we go through the nutritional status of the adolescent boys and girls, we see in a graph that 32% are stunted, 23% of boy and 14% of girls are wasted, 4% of both boys and girls are overweight, and 1% are obese. And we see that there are a direct link with the dietary diversity and anemia prevalence. So I am trying to present a small scenario how the adolescent boys are have a prevalence of anemia only 11%, and they are enjoying more dietary diversity, 48% of the boys, in comparison to 43% of girls are enjoying dietary diversity, minimum dietary diversity, so that their prevalence of anemia seems high. Ecological zone-wise, if we go to the prevalence of anemia, Tarai has more prevalence of anemia, where 29% of the girls and 14% of boys have anemia. But in hill and mountainous area, this scenario is a little bit hopeful, and the prevalence is lesser than Tarai belt. Though it's a very critical that Tarai have a maximum facility, road connection, availability is greater in Tarai area, but still the adolescent girls are more anemic in those areas. While talking about the reason for this compromised situation of nutritional status among adolescent girls of Nepal, we can say a few things. We can identify a few things such as poor access to health facilities, early marriage and pregnancy. I already mentioned about the depth of the problem, heavy workload, gender discrimination, and taboos related to different periods of life, such as menstruation period, pregnancy period, and motherhood period, and different during different religious activities and cultural activities. Those taboos are already associated with the girls mostly, and increasing influence of ready to eat and unhealthy junk food. Yeah, it's a worldwide problem most probably, and we are also suffering from the same problems. And intergenerational undernutrition, poor tiffin eating habits, and a school meal program, increased vulnerability during various emergency time period, and food insecurity as well. Various national policies, strategy, and guidelines related to adolescent nutrition are implementing in the country to address those problems and making them more enable for their betterment, such as the school health and nutrition strategy and health sector strategy for addressing maternal nutrition, multi-sectoral nutrition plan. Second, National Adolescent Health and Development Strategy 2007-5, weekly iron folic acid supplementation guideline for adolescents, adolescent nutrition guideline, adolescent nutrition situation analysis, and policy review. These are the attempt more focusedly addressing the adolescent nutrition problem in the country. And especially a priority intervention for adolescents are going on in Nepal through few programs such as weekly iron folic acid supplementation, focusing on adolescent girl is 10 to 19 years, those who are going to the school and out of school too, all. And all girls is 10 to 19 years are supplemented with weekly iron folic acid biannually in 2 rounds, July 16 and October 15. And each round they are provided with 1 IFA tablets every week for 13 weeks. And
Professor Uma, you have 3 minutes left.
Yeah, thank you. School health and nutrition program is also there, where worm infestation control, midday meal, first aid, and physical examination were done through this program. And other various stakeholders are also promoting and implementing various programs for the adolescent, especially promotion of health and nutrition diet, promotion of physical activities and healthy lifestyle, social behavior change communication campaigns, provincial and municipality level orientation, training to health workers, education and resource person, etc. But we have some short of vulnerability during COVID-19, and they are also facing the same. Such as self-harm is predominantly found among adolescent girls and boys too, such as mental instability, suicidal behavior, and social media use. They are quite new. Most of them are quite new for this. Social media and more prone to abuse or violence, lack of understanding of lockdown restriction, and unexpected work student life changes, and due to though I already mentioned that we have adolescent pregnancy and marriage situation, so institutional birth is decreasing, and stillbirth, infant mortality is increasing, and early initiation of breastfeeding within 1 hour of birth decreased by 3 to 5%. Despite these countless challenges during this COVID period, adolescent focus programs are achieving maximum of its target. The major driving factors for these are multi-sectoral approach or engagement. We are successfully implementing this program in our country, multi-sectoral nutrition plan. And another is continuous advocacy in our community level, and a strong commitment, especially of local government and community people and the workers of nutrition, and an effective engagement of female community health volunteers. These are the success behind our achievement of the target. Thank you very much for your precious time.
Thanks, Professor Uma, for that informative presentation and your remarks. And it's great to know about the multi-sectoral nutrition plans to address adolescent nutrition issues. I think one common thread that we witnessed even in Bangladesh from Saika's presentation and your presentation is the fact that adolescents definitely is a unique demographic group, and to reach them with nutrition education, strategies really need to be customized as per the varied platforms that they are present on. It needs to be communicated in a participative style that really engages them, that really has become the mantra for having successful adolescent nutrition strategies. Right. And in fact, thank you, Professor Uma, for that lovely presentation. And we do see there are some questions for you in the chat box. So I'm going to pass on to Anjali to moderate the Q&A.
Sure.
Hi, Professor Uma. Thank you for the beautiful presentation.
Hi,
and congratulations, for successfully implementing the VFAS program during the pandemic. Actually, related to that, a few questions today. The first question is how to ensure VFA supplementation and ensure compliance during the pandemic?
It is challenge, but still our community health volunteer FCSVs are quite active, and through health posts they are the only one who reaches door to door of every household. So they are the one who makes possible to provide all the IFA tablets for the adolescents.
Okay.
Yeah, they are going
There are a
door
couple.
to door. Yeah.
Okay. Yes, I'm sure, and that's very useful, because what has happened in other countries is that the community level health systems have sort of collapsed, and it's good
Yeah,
to know
yeah.
that they're still working in Nepal. There are a couple of questions related to how to keep adolescents meaningfully active, and engaged in nutrition. And there's also another question which is similar but focused on hard to reach areas, which we have in Nepal. So would you have any thoughts on that?
For the better engagement, we have some experience, and we have some lovely experience that whenever we go to the school, school to do advocacy for the adolescent girl, and we present the scenario of market food and how it is healthy for them, and what is the effect if they continuously taking it, and they are quite enthusiastic, and they are so encouraged and so curious about the market food and their advantages and disadvantages. So making them more engaged about the information and the health benefit of the homemade food or good food, and the health hazard of the market food, they are quite convincing. They adopt it so easily. They are so curious about to know all the things. So I think a good advocacy is always very, very beneficial for them to bring them in a mainstream, well informed, and motivate them. And yes, there are always challenges that these cohort of the population are so fragile and so easily attracted to the market and the advertisement. So we are quite conscious about these things, and we need to consciously advocacy for the market food and for the private sector also to work on those things. So I think we need to work closely with the private sector too, and we need to bring them in our network so that we can work together for the healthy food. And yes, definitely hard to reach area is always a challenge for us, and for that we have female health volunteer, community health volunteers, and they are the only one who are the change maker and dynamics group of our country. And they have a sole responsibility to spread out messages and other tools to the door to door. So they are wonderful, and they are carrying messages from various sources, and they are imparting it door to door. And other tools, yes, definitely nowadays social media and mobile and television, radio are quite effective media, and people are listening and using it. So through those media we can work, we can send small messages, and we can do a lot through these social media.
Thank you. That is very useful. There's an interesting question related to stunting and wasting. Prativa is asking that stunting and wasting are nutrition indicators for children under 5. How do you calculate this for adolescents using NDHS data?
Actually, adolescent has also the indicators of stunting and wasting, and it is not at the time of adolescent that it is going to be stunted and all the things. It is throughout the life cycle we need to work, so that we are quite concerned about the adolescent, and we are constantly advocating to work on adolescents so that their product, they could have a healthy motherhood, they could have a healthy pregnancy, and they can produce a normal and healthy baby. So these are the life cycle approach we need to see throughout. If we have a small stature adolescent and a smaller bone adolescent, they can have difficulties in pregnancy. So we are constantly working in a 1,000 days mother. That relevance is with 1,000 days mother. If we do a proper advocacy, proper intervention in 1,000 days mother, the child or the children are born normal, and they will grow as a normal adolescent, and they can have a healthy reproductive phase. So these are the cycle. No, we cannot focus only one stages of life. It is associated, it has a very good link with conception to death. So we have to have very concern about these things, and we need to work on a life cycle approach.
Agreed, absolutely. There's one more question directed to you. It's about how are the adolescent corners structured, the ones that you mentioned in your presentation?
Yeah. Every school we have young youth clubs, and they're normally used to display. They have in the school period, school time, whenever they have a time for extra curricular activities, they sit together and they impart various knowledge about nutrition, such as food pyramid, and we have developed Posan Nanglo, where all type of basic foods, how to eat and what portion we need to eat. We have created that Posan Nanglo and food pyramid. So they talk about those things, they demonstrate it in the school and the nutrition club, youth club, and these type of things they do. And sometimes they do a road drama, sometimes they do drama only. So these type of advocacy work they do in a nutrition corner, youth corner.
Excellent. That sounds very innovative, and I think it's also important to note, what you've seen from your and Nepal and Lucy's presentation, Bangladesh and Lucy's presentation, is that the programs are not uniform. While the recommendations for adolescents are uniform, the program has to be contextualized to wherever it is being planned. Even the communication channels will vary to where the adolescents are in a hard to reach area, rural area, an urban area, and so on. Dr. Uma, there's a question about side effects of IFA on adolescents. Could you talk a little bit about that?
Yeah, definitely. If that's why we are distributing in a 2 cycle, and there is gap. If you see there, we are only providing 26 capsule per a year of cycle. That's why we are quite concerned about those things, and we are not. With the advice of expert, we are not exceeding the amount of the IFA tablets.
Yes, okay, thank you. There's another question, that is very generic. So I'll probably direct towards Lucy. Lucy, this is about, during the COVID pandemic, we've not been able to collect data, and most nutrition surveys were conducted before the pandemic. So how do we know the real situation, and how do we develop strategies for adolescent nutrition during the pandemic?
So Lucy is addressing it.
Yes, I've asked Lucy
Okay.
to. Yeah.
Okay.
And Dr. Uma, you can also add on to it, maybe.
Okay, just a quick answer. Definitely there is a COVID situation and hard to reach for the community, but still our mechanism and ministries are working hard, and now they have digitalized all the information and they are taking through digitalization. So I think there is no such a very complicated situation to collect data.
Yeah, over to you, Lucy.
Thank you, Anjali, and thank you, Professor Uma, for that response. And I do agree. I think we have seen a lot of innovations in data collection, as opposed to before, when we used to rely a lot on data that is structured, the routine data. We've seen, for example, countries using community health workers and using telephone calls to collect real-time data, to be able to make decisions that require to be made quickly. But I think, we are realizing more and more, and I think the global community is realizing more and more that it is critical that we find ways of ensuring that we are able to not only collect data, but also collect data that is useful. And so, time is of essence, and, there have been innovations. Dr. Oma has mentioned use of digital systems, and I think it's time a lot of countries now think of digitalizing data collection and sharing. We have seen routine data be digitalized through the DHSs by a lot of countries. So it is possible to use these many different innovations to get data and to make sure that it is actually feeding into our decision making in good time.
Thank you, Lucy. And like you also mentioned in your presentation, we need to strengthen data systems. And because our programming needs to be based on recent evidence. And hence, I think that this pandemic has been a good opportunity in the sense that these virtual platforms are being used. I think that is all. Thank you so much to all the panelists for answering the questions. Over to you, Jigyasa.
Thanks, Anjali, and thanks, Professor Uma, Lucy, and Saika for those really interesting presentations. And one thing that has come out very clearly with this webinar is the intent to divert more attention towards adolescent nutrition. It's quite evident that due to school closures and other limitations during the pandemic, adolescent nutrition interventions have been critically disrupted. A multi-sectoral collaboration to bring back adolescents' nutrition on the radar of government priorities is really the need of the hour, and it gives us immense pleasure to see that the nutrition community in many countries is already working hard to ensure that the youth and their health and nutrition gets due priority in country goals. We wish you all the luck in your dedicated efforts. And we move on to the end of our sessions, and I would now like to invite Tomoko Nishimoto, the Regional Director for Asia at Nutrition International, to deliver the closing remarks. Tomoko is a relentless promoter for inclusive and sustainable development with empowerment, equality, and social justice close to her heart. In particular, she is a firm believer and strong advocate for gender equality and women empowerment. In her current role at Nutrition International, she is overseeing the development and delivery of the organization's programs and projects in Asia. With over 34 years of multi-sectoral experience in sustainable development, Tomoko has held senior management positions in the International Labour Organization, the UNICEF, the UNDP, and the UNEP. We're delighted to have you with us, Tomoko. Over to you.
Thank you, Jigyasa. It was indeed a very rich and invigorating discussion. I hope each one of the participants enjoyed the discussion as much as I did. I thank most sincerely the speakers who shared their knowledge and experience, especially Mr. Christopher Twiss from the Sun Civil Society Network Secretariat and Professor Uma Koirala from Civil Society Alliance for Nutrition in Nepal. I also thank those who amongst the participants who are making similar tireless frontline efforts in their respective organizations. Thank you all for your commitment and leadership. Today's discussion was rich as it was full of useful data and analysis, culminating in several insightful recommendations and ways forward. A true example of information is power. It was invigorating as the discussion very vividly reminded us that we have so much more work left in the area of adolescent health and nutrition. The percentage of adolescent girls and boys who suffer from malnutrition worldwide is way too high, as shown by the speakers. These adolescent girls and boys are future leaders, workers, employers, teachers, doctors, nurses, and many more. In other words, they are the backbone of the future development and prosperity of their countries and beyond in this globalized world. We all know the backbone must be built strong and well supported for any venture, let alone the nation building and for ensuring sustainable development. Unfortunately, statistics and data show that the reality is far from the ideal. It is also very disheartening to see how the COVID-19 pandemic has made the already daunting task even more difficult. Adolescents have been hugely impacted by the nutrition crisis brought by pandemic. It is critical to ensure that nutrition is integrated into every phase of the COVID-19 response and recovery measures. The nutrition community has been pressing forward this point for some time, with some success, but not enough, as we heard. Adolescent nutrition remains an underrated agenda in many countries. We need to be louder than ever in order to ensure that a new normal after COVID has nutrition at its core and well integrated in every aspect of countries' short-term plans and long-term strategies. All speakers pointed out that prioritization of adolescent nutrition should be thought through a multi-sectoral approach. During our first webinar on this series, we heard excellent examples of multi-sectoral approach from Pakistan and Indonesia. Today, we also saw the same emphasis in the work in Bangladesh and Nepal. Africa is moving towards that trajectory too. We need more and more countries to take bold steps towards such multi-sectoral approaches as they integrated nutrition into their national recovery and development strategies. Another very pressing issue that has been highlighted today is the dire need to explore supplementary needs to reach adolescents. The pandemic has made it clear that with school closures, teenagers are not only miss out on their education, but also the multiple health and nutrition services delivered at school. This is the time to brainstorm innovative ways of delivering nutrition-specific interventions to the adolescents. At Nutrition International, like many of you, we were having robust discussions on this point. Now, despite the daunting task and challenging the situation, it was really inspiring to hear from the speakers about the incredible work being done in Nepal and Bangladesh. The insights from Africa added value. This is an indication that Nutrition International attaches a high importance to intra and inter-regional knowledge and experience sharing and learning. Both presentations from Bangladesh and Nepal made it very clear that engaging the youth in decision-making and using more participatory approaches considerably contribute to the success of effective adolescent nutrition interventions. Indeed, young people have marvelous energy and ideas, which once harnessed have unlimited potential for remarkable impact. We must make sure young people are part of the solutions and proactive agents for change. In working for the discourse of adolescent nutrition, Nutrition International has been supported by and working closely with partners in the SUN Civil Society Network. Nutrition International is very pleased to be an active part of SUN Civil Society Network in Asia, Africa, and beyond. This is the last webinar of the two-part series. The first webinar was attended by more than 600 participants. It is a testimony of our close collaboration and collective commitment to our common goal. At Nutrition International, we are firmly committed to continuing to play our part in this collaborative journey. I would be very pleased if today's event has reached out those who are new to this discourse and the journey and made them determined to take one step forward with us. We know every step counts. What would be your next steps? Let us hear your stories in future webinars and other interactions. Please join us to plan for more sharing. Thank you all, and please stay safe. Over to you, Jigyasa.
Thanks a lot, Tomoko. Those were really motivating remarks. And as we end the webinar today, I'd like to just share that this webinar was a two-part series co-hosted by Nutrition International and the Scaling Up Nutrition Civil Society Alliance's Asia Coordination Group. Many of you would have been with us in the first webinar as well, which was held in early September. To all our participants, new and old, all those who joined us on Zoom and are with us on YouTube, a very big thank you. Your participation is very gratifying and motivates us to keep the good work going. On that note, goodbye, take care, and stay safe. Thank you.